Hello, welcome to Mental Health Partnerships. My name is Dr. Janine Lasitsky, and I serve as the President and CEO for Mental Health Partnerships. All of our programs and services support people with mental health conditions in creating a meaningful life in the community. And in the last year, we served over 11,000 people through advocacy, direct services, and training programs. Our work is rooted in a peer-driven culture and recovery values such as empowerment, strengths-based perspective, non-judgmental support and respect, hope, and a holistic focus.
Hello, and thank you for choosing to volunteer your time with Mental Health Partnerships. We are thrilled to have you on board. Before we get started, we'd love to share some key information about who we are and what we do. Mental Health Partnerships, or MHP, was founded in 1951 as an advocacy organization. In our early years, we played a major role in helping individuals transition out of state hospitals into community-based programs where individuals could map out a meaningful life in their own community. However, we quickly realized that advocacy alone wasn't enough to fully live out our mission. So we expanded our efforts to focus on two additional core pillars of service in addition to advocacy. Today, we have three core pillars of service: advocacy, direct services, and training. Let's take a closer look at each of these pillars. Advocacy. At MHP, we approach advocacy on both individual and systemic levels. On a micro level, we assist individuals with mental health challenges in navigating various public systems, including the justice system, housing system, and mental health system. This includes advocating for individuals in mental health court, in behavioral health system hearings, in hospital, and a variety of other settings. We offer a chat line for people who need support in navigating living with mental health challenges, as well as accessing needed resources and services. On a macro level, we use our network and connections to influence policy changes at the federal, state, and local levels of government, both legislative and administrative branches, to ensure that mental health care and necessary resources and support for people experiencing mental health conditions continues to improve on a larger scale. Direct services. MHP operates across southeastern Pennsylvania with locations in Philadelphia, Delaware, Chester, Montgomery, and Bucks counties. Our direct services are divided into several key programs. Mobile peer teams. Our mobile peer teams consist of individuals who are certified peer specialists, often having completed their CPS coursework with MHP. These teams provide one-on-one support, peer support services designated to promote hope, choice, empowerment, and self-determination. This is done through the development of mutual relationships and the utilization of natural community and service supports. The purpose of this service is to inspire hope that recovery from behavioral health or co-occurring challenges is possible. These types of services and activities are multifaceted and are guided by the belief that individuals need opportunities to identify and choose for themselves their desired roles with regard to living, learning, working, and social interaction with the community. In addition, peers help participants navigate mental health challenges to achieve personal goals, whether independent living, educational, employment-related, social, and other domains. We also have a Community Autism Peer Specialist, or CAPS, team, which provides the same support, but specifically for individuals on the autism spectrum. Recovery Learning Centers. Our Recovery Learning Centers provide a welcoming space where individuals can access essential resources. These centers are open during regular business hours and offer showers in the morning, laundry services throughout the day, mental health, housing, and other resources, job readiness training and support, socialization activities, a comfortable place to rest, cool off, or warm up. Throughout the day, we also facilitate groups on topics such as wellness recovery action planning, coping skills, medication, current events, and co-occurring disorders. Homeward Bound is MHP's 18-bed residential facility providing a supportive, home-like environment for adults 18 or older with mental health conditions. With separate living spaces for different genders, the program helps individuals transition towards greater independence in a recovery-oriented manner. Residents typically stay for about a year, during which they participate in evening therapy groups led by co-occurring therapists. They also receive psychosocial rehabilitation services, personal assistance, social recreational activities, education, and medication monitoring. Each resident plays an active role in shaping the culture of the home while making daily living decisions, fostering a sense of autonomy and self-direction in their personal recovery. Homeward Bound emphasizes wellness across various life domains. Residents have access to exercise programs, a comprehensive food service program where they learn meal preparation, basic cooking techniques, menu planning, and grocery shopping. A culinary health coach welcomes new residents by preparing their favorite meal and supports them in developing healthy cooking skills. Additionally, residents collaborate with staff to create individualized goal plans focused on self-sufficiency and empowerment. A community garden provides space for planting flowers or vegetables, serving as both a therapeutic activity and a metaphor for personal growth and recovery. By providing a safe, structured, and supportive environment, Homeward Bound empowers individuals to build the skills and competence needed to transition successfully to independent living. Outreach and targeted case management. Case management is designed to ensure that individuals gain access to needed medical, social, and educational resources, as well as other agencies whose functions are to provide the support, training, and assistance required for a stable, safe, and healthy community life so that the participant can be reintegrated into community living. Our case management teams provide hands-on support tailored to different populations. The SHARE team supports individuals who have experienced increased inpatient hospitalizations in the past year. Access 1 and 2 teams work with individuals experiencing housing insecurity. Forensic case management assists those who have been involved in the criminal justice system. Our outreach teams operate in 2 locations. Our West Philly team works overnight, and our Delaware County team operates 24/7. Both teams engage with individuals experiencing homelessness, offering resources and connections to shelters, safe havens, and MHP services such as the Recovery Learning Centers. Representative Payee or REP Payee program. The REP Payee team helps participants develop financial independence. Account specialists work with participants to set financial goals, whether it's paying bills on time or saving for a car, and create a structured budget. The team also assists with bill payments to help participants stay on track financially. Training and education, the Institute. Our training department, the Institute, provides a range of courses to equip individuals and organizations with valuable skills and certifications. The Institute at MHP provides certified peer specialist training for the states of Pennsylvania and Florida. We also develop curriculum and have a catalog of over 30 continuing education for CPSs and mental health professionals. Additionally, the Institute at MHP facilitates a course on CPS professional development called The Practical. Allied Family Network, or AFN, provides psychoeducational training and coping skills for families of individuals with mental health challenges. AFN delivers support to families and caregivers through the TEC or TECH program funded by DVH IDS and the ADHD Parent Coaching and Training Program. Annually, AFN delivers workshops, seminars, referrals, and consultations, as well as support groups to families in Philadelphia and surrounding suburbs. Parenting Plus is a course focused on healthy parenting strategies to support families navigating mental health challenges for parents living with mental health diagnoses that are at a risk of out-of-home placement. This training is funded by PHMC. At Mental Health Partnerships, we are committed to advocacy, direct support, and education to empower individuals on their mental health journeys. As a volunteer, you are now a vital part of this mission. Thank you for being here, and we look forward to the incredible impact you'll make.
Welcome again to Mental Health Partnerships. As you know, I am Dr. Janine Lasitsky, President and CEO of Mental Health Partnerships. At Mental Health Partnerships, our secret sauce is a unique blend of diversity, expertise, and compassion that creates a transformative environment for everyone involved. Our dedicated staff, many of whom have lived experience in mental health recovery, genuinely care about the safety and well-being of our participants. This come-as-you-are culture values every individual, fostering meaningful connections that empower growth and independence. Together, we turn challenges into strengths. We are more than just a workplace. We're a tapestry of people dedicated to healing and growth. Together, we build hope. We are excited to get to work with you. Thank you for prioritizing Mental Health Partnerships' mission and for dedicating your precious time to be part of our vision to build a community where people with mental health challenges are fully included and engaged, live the lives they imagine for themselves, and engage in the promotion of recovery. Thank you.